Well, good afternoon. I am here and joined by Mayor Mike Duggan. Today we're going to share with you where we are in the city of Detroit as it relates to COVID-19. What I will share with you is our positivity rate, our hospitalizations, as well as the number of cases. As you can see here, the positivity rate has doubled in the last 10 days. We started at about 2.8%, and now we are up to 6.3. Our numbers are going in the wrong direction. In terms of our hospitalizations, they're also increasing. Just a few weeks ago, we were at 69 hospitalized patients who tested positive for COVID-19, and now we're up to 91 in the last 30 days. So we are sounding the alarm. And finally, for our number of cases per million, it's also on the rise. In the last 7 days, we increased from about 56 cases per day to more than double at 123 cases. Now, the biggest proportion of these cases is among 20 to 29-year-olds, who account for 20% of the positive cases, followed by 50 to 59-year-olds, who account for 13% of all cases. All this is very concerning, but there is some good news, and that's that we are seeing a reduction in the proportion of positive cases among Detroiters aged 60 to 69 years old. What that means is that the vaccination effort that we are putting forth in the city of Detroit is working, and we cannot stop this momentum. We are also seeing in our testing that the rate of testing has also decreased. Just a few weeks ago, we were testing all across the city about 2,000 people per day. Now we're down to 1,700, so we cannot let our guard down. As a reminder, if you feel as though you have been exposed or you have symptoms, please get tested. You can get tested for free right at the Joseph Walker Williams Community Center or Rosa Parks Boulevard. You can make an appointment by calling 313-230-0505 to get your test. We are also seeing a steady increase in new positive cases in schools, especially amongst the athletes. And I do want to encourage parents to get tested if you have symptoms or have been exposed, and also get vaccinated to protect your students. This is really important so we can cut down on the number of students who have to be in quarantine anytime a student tests positive. Again, the entire team needs to be in quarantine, and so we really want to avoid that. I do want to thank all the parents who have been they've really been focused on getting vaccinated, so please make sure that they continue to do that. There apparently appears to be a tug of war between testing and also vaccination. Both are vitally important, and I do want to encourage you to make your call, make an appointment, and get it tested when it is your turn. And finally, let me close by encouraging everyone to keep observing the CDC safety guidelines. Keep wearing your mask, avoid large crowds, wash your hands, and get vaccinated when it's your turn. And even if you've been fully vaccinated, which means 2 weeks after getting your final dose, we still recommend that you continue to wear your mask. This is very important because of the rise in cases that we are still learning about, as well as the B.1.1.7 variant. So please do not let your guard down, and please get vaccinated and also mask up. And with that, I will turn it over to the mayor.
Thank you, Denise. I want to take you through some numbers and tell you what we're going to do about them. But what Denise Fair just took you through is a trend you're seeing across the state of Michigan. We do have an increase now. It really is very similar, not quite as steep as March a year ago, but March, April was a very intense infection period in Michigan and Detroit, and it appears March and April are picking up again, except in the ages where the vaccinations have been extensive. But I want to show you what is happening, and what I'm going to show you right now is heartbreaking. On January 13th, we sat in this room and announced that any Detroiter 75 or older could get vaccinated in the city of Detroit. You called, you were within a couple of days, and you got vaccinated. In the last 2 weeks, we've had 5 Detroiters between the ages of 75 and 93 die of COVID, 2 months after they were eligible for vaccinations. Around January 20th, we started vaccinating Detroiters 65 and up. In the last 2 weeks, we've lost 3 of our neighbors between 65 and 70, people who for 2 months have been eligible for vaccines. And on February 2nd, we became the first city in the state to open vaccines to restaurant workers. And it was heartbreaking last week to lose a restaurant worker in his 40s to COVID. I talked about this in January and February. I said by March or April, we are going to be going to funerals that could have been avoided. We are now closing in on 200,000 vaccines in this city. You're getting no reports of people having bad effects from the vaccines, but there are tragic consequences for those who don't get them. And this is going to continue to be the case. And it's important that you reach out to folks who have been skeptical, accompany them, take them in, because you may be saving a life. So here's what we are going to do differently starting today. Anybody who is working on a job site, who either lives or works in Detroit, is eligible for a vaccine right now. You work at any business in the city of Detroit, whether you're a hair and nail salon worker, whether you're working at a clothing store, whether you're working in an insurance office, it doesn't matter. If your job puts you in contact with other people because you have to leave your house and you're on the job site, you can call 313-230-0505 today, and you can get a vaccine this week. We have to stop this spread of infections. We know that people who go to work and are interacting with other people are more at risk. And so whether you go to a job in the city of Detroit or whether you're a Detroiter who goes to a job in the suburbs, if you live in the city or work in the city, you can call right now and get vaccinated. And I know I've already heard from my friends in the media who also are in this situation, including some of the suburban TV stations whose employees are working in the city of Detroit. You're eligible. And I interact with the folks in the media on a daily basis. They are always at risk with the contacts. Now, you're eligible as well. So if you have to leave your house to go to work, you can call and get an appointment. If your company in the city of Detroit's got 100 or more people that will want a vaccine on site, we'll come to you. Denise Fair and the health department will come out. And so our major employers, we're already talking to them and scheduling dates. It'll probably be next week. It will probably be the Johnson & Johnson one-shot vaccine when we come out, so you only have to do it once. But if you would like to have the Detroit Health Department come out to your place of employment in the city, there's going to be more than 100 shots. You can call 844-333-8249, and they will schedule an appointment in the next couple of weeks. Here's the other thing we're doing. We are following the governor's lead, and we are expanding access to any Detroiters 16 or older with disabilities or underlying health conditions. And so we've talked about this before, whether you may have asthma or a heart condition, cancer, any range of disability. Now it doesn't matter what age you are, you're eligible as well. And so you can call and make your appointment. When you get to TCF, you'll just have to show evidence of your condition, whether it's your prescription pill bottle, whether it's a letter from your doctor, whether it's an insurance bill, something that reasonably shows that you do have that condition. It also applies to the caregivers or guardians, the folks who are taking care of you, to make sure they are COVID-free as well. And so you have a little bit of an interesting issue in that Pfizer has been tested when they did the test on 16 and over. Moderna was tested on 18 and over. And so at least for now, only Pfizer is been approved for the 16 and over. And so we will just make sure if you happen to be 16 or 17, we will schedule you on a day when there are Pfizer shots. So if you're 16 and up, just call the number and we will work out the details. So Wednesday, We're going to have a huge vaccination site at Ford Field that the federal government and the state of Michigan are running. And so there's no confusion out there. I want to talk to you because Ford Field and TCF, the two largest vaccination sites in the state of Michigan, just blocks apart, are going to be operating at the same time. So who's doing what? For Detroiters, you actually, for the most part, have a choice. So at Ford Field, if you're 50 plus, you can go there, but they'll take anybody in Michigan, including Detroiters. At TCF, if you're a Detroiter, you can go there. If you want to stay in your car and get the shot in your car, call up and go to TCF. If you just assume park and then wait in the comfort of Ford Field, there's nothing that stops any Detroiter from going to Ford Field for that appointment. But the Ford Field appointment is from everybody in Michigan and anybody 16 plus with disabilities or medical conditions. If you're anywhere in Michigan, you can go to Ford Field. If you're in Detroit, you can go to TCF. But again, I'm going to say this, Detroiters have a choice. You can go to either one. And so they're both going to be extremely well run. It's just a question of do you want to stay in your car or do you want to get out in the car? I'm sure we're giving the same vaccine at least for the next couple of weeks. There's one difference. If you are living or working in Detroit and you have to show up for your job site. If you are eligible because you're leaving your house for your job site, you have to go to TCF. You're eligible at the city. So far, they have not declared that eligible for the state. And so the only people who need to choose between the two or have to take TCF are those who are going to a work site. It's not going to matter very shortly because on April 5th, all Michigan residents 16 or more are going to be able to go to TCF or Ford Field. And so pretty soon, it isn't going to matter. But for the next 2 weeks, we want to concentrate on those individuals who have got to go to work. You are at risk. And so I think by now you know the process. TCF, you call the phone number. At Ford Field, you register online at the Myers site, and they will contact you back with an appointment date. And this is where we need to be. We need to be with a lot of options. And then the Saturday community events, which have just been enormously successful. And so we have 4 churches that will be at this Saturday. Greater Emmanuel, New Providence, Galilee, and Denise, my eyes aren't as good as they should be. What's the other one?
Providence.
The first one in the upper left. Great Faith.
Yes, Great Faith.
Okay, so they came a little smaller, but those 4 will be open on Saturday as well. So you're going to have choices of Ford Field, TCF, and the 4 churches on Saturday. And so we are at a point now where we can break the back of COVID once and for all with the vaccination effort, or we can continue to let this linger. I really think the city can be completely open again by this summer, but we have to get out and get our vaccinations. With that, we'll take any questions.
Good afternoon. Good to see you both. Couple quick questions. When the governor was talking about this, similar messages as you both today, they noted as well no bumps, though, or similar growth in the numbers of those that are dying of COVID. Do you think this leads to people getting a false sense of security? I'm just curious in regard to the, it doesn't seem to be corresponding as it did months ago in regard to rising cases and rising fatalities, and I'd like your insight.
Yeah, it's only a tragedy if it's a member of your family who dies.
Right.
People are tired of COVID. I mean, everybody feels that way, and we're not that far from the end. So it's hard to get into the psychology of each individual's decision. All I know is you are in the only city I know of in the country that you can dial the phone right now and have an appointment for a shot within a couple of days. And I just hope Detroiters take advantage of that.
And I bring up something in the headlines today, the same group that was outside of the ballpark, Republican legislators in Holland today, and I'm not trying to get political, not trying to get you to comment on them, but it seems if for the public going home, they're getting mixed messages. Those saying open up, the legalities of that and the politicalization of that, with the message from many people that it's still not over, et cetera. I'm just wondering your thought in regard to the mixed messages we seem to be getting.
Again, Detroiters aren't confused. Look at the numbers. The Detroit infection rate is still running about half the rate of the surrounding suburbs. People of this city have no trouble understanding that if you're African American and you get COVID-19, you're 2 to 3 times as likely to die as a Caucasian. And so there may be different messages in different places, but our message in Detroit is really simple. Right now, CDC has said if the two of us both have vaccination, we can have a meeting together without masks. We're starting to get to the point in the mayor's office where we can sit down without masks because people have been vaccinated. If you want to get your life back and reopen, go get the vaccine.
2 more. Denise, you mentioned high school athletics and athletes. The governor again referenced this last week, Friday. Talked about testing. From where you sit and what you know now, there seem to be some gray areas here in regard to testing requirements. Will these be administered by schools? Will these be the requirement of parents of athletes? What about community sports? It seems to be kind of an open-ended question here on how that's going to happen, if you have any insight.
We're going to follow the lead of the governor's office, and what she said was, I believe, really clear. Excuse me. It was very, very clear in terms of weekly testing for student athletes, and we have been in regular conversation with Dr. Vitti from DPSCD, as well as the charter schools and the private schools. They want to vaccinate their students, and we want to partner with them. We have several antigen testing kits that we can provide to the schools, and we'll provide more details on that later, but they are definitely open to it because they want to, they want to get back to some sense of normalcy as well with their students.
But in an overarching sense, do you see this as being school-driven? Will there be enough kits, et cetera?
I think this will be a partnership between the schools as well as the city of Detroit. We have been very supportive of the schools, and I don't see that changing going forward.
We have plenty of kits. Test kits are not an issue.
Okay.
And our coordination with the Detroit Public Schools has been great, so I'm sure it'll get worked out.
My last one, Mayor, is in regard to opening day, now that we know it's going to be about 8,200 fans. Are you in discussions at all? Are you talking at all in regard to any special enforcement measures, any messaging? Are you worried at all about people gathering outside the ballpark?
I'm going. I think people need to be responsible, but when the governor lifted it from 1,000 to 8,000, I haven't missed an opening day in a long, long time, and I'm glad I can go this time.
But in
And
regard to gatherings outside of the park?
Again, we'll do the best that we can, and I don't know what else to tell you, is that we'll do the best we can. We're getting to the point now where the vaccine is becoming available to everybody, and at some point, folks are going to make choices and are going to have to live with the consequence of those choices. But we are moving past the time where you couldn't get the vaccine. We're now moving to the point where everybody can.
Thank you.
Good afternoon.
Good afternoon.
I have one quick question, please. Detroit is a highly diverse population with a very large segment of immigrants coming from around the world. With some of these families, there are members who are not yet documented and not comfortable with coming out and signing up with a government service like the vaccines. So my question is, how does the city plan to approach this sometimes forgotten group in terms of getting shots in their arms?
That's a great question. We recognize that, which is why the mayor and also the health department are really focused on bringing the vaccine directly to those who need it most, those who want it. We've partnered really closely with LaSed, which is a community in Southwest Detroit, and we've held, I believe, 3 or 4 pop-ups right in the comfort of LaSed, the community center. And whether you are a restaurant worker, whether you are a senior, if you're living in Southwest Detroit or anywhere around that area, you can feel comfortable to come directly to us. We're not going to ask you any questions. We're going to ask for some sort of ID. But it's a safe environment, and we continue to have pop-ups all across the city of Detroit. So again, our goal is to create options for Detroiters. We've created Senior Saturdays, which are now Community Saturdays. So if you don't feel comfortable going to the TCF Center, you can go to a neighborhood site near you.
Okay,
No city of Detroit employee will ask your immigration status. That's not our role. Our role is to get you vaccinated, and we're going to do that regardless of your immigration status.
Okay. Thank you both very much. Appreciate it.
Mayor, there's been some press coverage in the last week or so about TV personality Nicole Curtis involved in a legal dispute with the land bank, and some reporters have asked if you had any thoughts on that.
I'm a huge Nicole Curtis fan. She is great for the city of Detroit, and I love her show. But if there's one thing that bothers me about the coverage, you would think she's the only person in the city who's renovated a house. We've had 8,000 people have renovated abandoned houses in this city in the last 8 years, and we're appreciative of all of them. The issue in this case, though, and I feel bad for Nicole, it appears she was scammed. It appears she paid somebody who didn't own the house and paid them to buy it. But the land bank can't legally just give her the property. Law in Michigan is that government can't turn over property to a private citizen without getting value. So you can't come in and say, I made a mistake, I paid somebody who didn't own the property, so City of Detroit, give it to me for free. The land bank can't do it. And the courts have already ruled twice it's clearly the land bank's property. I suspect they will a third time next week. And so I'm hopeful that Nicole Curtis will come forward and offer value. I'd like her to have the house. I'd like her to renovate the house. But as skilled as she is in staging critical stories about the land bank, she can have 100 critical stories. The land bank's not going to break the law. They can't turn the property over without getting value. So I'm hopeful that she'll come in, offer a reasonable amount, and the land bank can work it out. But that's the only way they can do that transaction.
Okay. All right, that was our last question.
All right, thank you very much.